So, did you know that people develop autoimmune diseases because their body is having a difficult time handling trash? A lot of my patients ask, what's an autoimmune disease and why am I developing this? I'm going to tell you about this. I'm also going to give you 5 tips on how to protect yourself in some way. Okay, so my name is Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area. I help people with joint pain and autoimmune disease become pain-free and get their immune system back on track so that they can live healthy lives. Okay, let's get to it. So there are many theories on why people develop autoimmune diseases. I'm going to tell you about what I think resonates more with all the conditions that I treat. And so I'll give you the 411 on it. Okay, so if we think about the immune system, it's basically our body's trying to get rid of trash, right? And so cells in our bodies, they live, they grow, and they die. And you actually see it on a daily basis. When you see that dry skin on your hands and you kind of shake it off, that's you trying to get rid, that's your body getting rid of dead cells, right? But when we're thinking internally, though, how does body get rid of cells that are lying in different parts of the body? That's a different story, right? So the body has to get rid of trash. And so I live in Seattle. So I think the best analogy is if we think about a beautiful sunny day in the summer, okay, you put your trash in the trash bin, you take your trash bin to the street, the trash guy comes in, they with their truck, they empty it into the big trash van, right? They drop your bin behind, you come home, there's no trash on the street, you take your bin inside, everything is nice, organized, choreographed, no trash on the street, everything is going according to plan. But on a rainy, blustery, gusty day in Seattle, when you get home and you find your trash is on the other side of the street, half of its contents are scattered everywhere, and the trash guy comes in and he eyeballs your trash on the street. He ignores that. He picks up the 50% that you have left in your trash can, empties it into the trash truck, puts your trash bin back, and they're off. So now there's trash everywhere. This is similar to what happens when people are developing autoimmune diseases. So, as I said, the cells are growing and then they die and they need to be gotten rid of. So when a cell dies, normally it should die by implosion, right? Think about crumpling a piece of paper, right? And so when it dies by implosion, then little fragments come off and they are taken up by cells known as macrophages, and they go to the liver and the spleen and they are neatly taken care of, right? But when a person is going to develop an autoimmune disease, though, the cells will die by boom, explosion. And when they die by explosion, then there's nuclear material scattered everywhere. Just like that rainy, gusty day in Seattle, there's trash everywhere. And so the body's macrophages, well, they can't keep up. So they do the best they can. And now you have cells with nuclear material kind of lying around. Well, your body knows what to do when it sees foreign things. It creates antibodies. Now, although they're not foreign, the body has never been exposed to it before because they've always been kind of neatly packaged. Now, this raw material just running around crazy, and the body says, well, I'm going to develop antibodies to all this nuclear material because they really do not belong in the system. And that is how the body develops antibodies to itself. An example of this is something like lupus, right? So for people who are predisposed to developing autoimmune disease, and you can ask, well, how am I predisposed? Well, one is just if you have a strong family history. Just because your mom, siblings, or even your twin sister has lupus or even an autoimmune disease does not mean that you have 100% likelihood of developing it. In fact, identical twins with lupus, only 33% of them will develop an autoimmune disease. So yes, a family history is a risk, but it's not 100%. But what are the things that we can do right off the bat to minimize our likelihood of developing a full-blown autoimmune disease? One, you know where I'm going with this, right? You want to avoid toxins, right? So you want to avoid toxins. Toxins range from cigarette smoking to even insecticides. And that is why we want to make sure that we're eating healthy, unprocessed foods, right? Other things that are important include exercise and eating a healthy diet. So my name is Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area. Contact us at overlakearthritis.com if you think we can be of help to you. If you think this video has been helpful in any way, like it, share it, and wishing you a happy new year. Take good care. Healthy and happy. Take care.